Hello, my name is Haley Davis, and I will be doing a presentation voiceover on the impact of brain damage on cognitive function. I first became extremely interested in this topic because of the Phineas Gage case. This is kind of where it all began. In about 1848, Phineas Gage, who was a railroad worker in Vermont, I believe, suffered a brain injury from an accidental explosion from packing gunpowder into a hole. This explosion sent an iron bar through his skull, damaging his ventromedial prefrontal cortex. Although the healing process for Phineas was pretty difficult, um, mostly because of infection, Phineas was able to continue to walk and talk, and he had ultimately survived this tragic incident. Although he was physically fine, he had undergone significant personality changes. They had noted in the textbook that before he was polite, respectful, popular, and even reliable. But after the accident and even being cured and healed from infection and etc., he became fitful, impatient, and his friends and family had even said that he was no longer Gage anymore. But something that's interesting is that this part of the brain is important because it holds the emotional regulation, motivation, and social sensitivity part of who you are. So, traumatic brain injury, or TBI, from a diagnosis standpoint. So you can become diagnosed with TBI not just from blunt force trauma like what happened from Phineas Gage, but you can have brain tumors, infections, cancers, uh, things like that. Anything that can affect the brain or damage the brain. So there's this quote that I found from a source. Clinical signs considered sufficient to warrant a diagnosis typically include one or more of the following: acute intracranial injury on neuroimaging, neurologic deficits, unconsciousness, amnesia for paratraumatic events, and confusion or similar evidence of altered mental status. So some of the physical symptoms may be nausea, dizziness, headache, blurred vision, hearing changes, fatigue, and etc. Some cognitive symptoms may be deficits in memory, emotional lability, irritability, depression, and anxiety. And something I found really interesting as well is subpopulations. So this includes athletes, which we'll get into brain injuries from American football players, I think in the next slide, but military service members. I read a lot of articles regarding like explosives in Afghanistan and this causing TBI in military service members. And then, of course, accidental brain injuries from the remainder of the population. Okay, so some mental illnesses caused by brain injury. And this is all depending on where the brain, where the part of the injury is in the severity. So, brain injuries can cause psychiatric and behavioral issues. So, these consist of substance abuse, cognitive disorders, post-traumatic stress disorder, depressive disorders, and personality disorders. So, one of the really big paradigms right now in brain injury is sport concussions. They've definitely had a lot of popularity around the difference that occurs with sport concussions. One thing that I found really interesting is even high school players experience over 1,000 head impacts per season. So if you're playing football for 4 years, you're getting an impact into your head over 4,000 times, roughly. But this can cause CTE. That's chronic traumatic, and I'm not going to say this correctly, encephalopathy. But it was first described in American football players as a progressive neurodegenerative syndrome leading to neural loss coupled with protein plaque deposits in the brain as a result of repeated mild traumatic brain injury. So this is usually caused by repeated concussions and some subconcussive blows. Some symptoms regarding CTE are memory loss, speech, behavioral, and emotional changes, and etc. Of course, some of a leading cause of because of brain injury is substance abuse. Substance use disorders correlates of post-TBI psychiatric problems. So this is because it's not necessarily causing you to automatically have more addictive properties in your personality, but it's being used more for self-medicative purposes. So this might be a numbing agent for a very new onset depression or personality disorder that's been occurred, and it goes hand in hand with those, or as an actual physical numbing agent for chronic pain. So this could be headaches or things like that. And of course, because Phineas Gage had also experienced emotional and behavioral differences, I wanted to put this in as a slide. So a lot of times there's a heightened emotional regulation issues, depression, anxiety, and irritability. You can have heightened aggressiveness, paranoia, impulsivity. You can have a lack of awareness, and of course, substance abuse, like we discussed earlier. Behavioral responses after moderate or severe TBI are often described by survivors and caregivers as personality changes. So we went full circle from what Phineas Gage has experienced all the way back into the 1800s to a quote that was in 2022. And another big factor with brain injury is memory loss and other issues. And I believe this could probably be a whole slideshow in and of itself, but I'll go ahead and touch base on a few things. I had read, I guess it's kind of like a memoir by, I believe it was Floyd Skylute was his name, and he had some really great insights to a brain injury that he had, and he had gotten it from a brain infection. He ended up having something called aphasia. I believe this is what it's called. He didn't actually say it in his journal, but it's getting words mixed up almost. He did have difficult time finding the correct words when he was speaking. It would be really hard. He'd be searching for a word. It was hard for his memory to come up with that. But not only that, is like if he was sitting at the dinner table and he wanted to say, "Will you please pass the rice?" He would say something like, "Pass the sawdust." He would kind of get words mixed up in his brain. Another thing that would occurred with him was dyscalculic, and it was him struggling with doing math, and it was very simple math problems. Like he would say it was really hard and difficult for him to have recipes. So if something called for a cup, it would be really hard for him to understand half of that, which would be just a half a cup. So not only that, it kind of depends on the severity of the brain injury, but bilateral damage to the medial temporal lobe or diencephalic midline can cause memory impairment without affecting other cognitive functions. So I wanted to put this, it was kind of an older article, but she talked about amnesia a lot in this article. And she came up with the point that amnesia had a certain severity as well, depending on how much of this portion of the brain was actually damaged, is how much amnesia you had. And I read a few articles as well that I did not have room to put in the PowerPoint, that some completely didn't remember their entire childhood based on the amount of damage that had come to their brain. But here's my references. I found this topic to be extremely interesting, very heavy. I think each one of these slides could have been a full 10 slides in and of itself. But I hope you enjoyed, and thank you for listening.